All right. Thank you everyone for joining us today on our webinar on taking control of your team's medical health insurance renewal. Exciting topics, right? It's a big deal for both you and your practice finances and your team's well-being, right? So it's important on all of these levels. Normally I give like this tiny little intro, but Cory's got so much going on that I'm going to brag on him for a minute. So we're excited to have Cory Friedman here with us today. He is leading the veterinary division at Alera Group, which supports practices nationwide with benefit solutions, so veterinary specific. He's been recognized as a leader in the insurance and benefits field, earning awards with names like Rising Star, and he's America's Hot 100 list for business insurance the past 2 years, which feels exciting. He's published in Today's Veterinary Business and DVM 360, so we know he's legit. He's got his own podcast. He's also written a book. He's literally written the book on it. He's always quick to help me when I need it, and today he's here to share strategies that will help you feel more comfortable and in control as we head into this insurance renewal time. So please join me in welcoming Cory.
Thanks, Megan. Appreciate it. Wanted to say hi to everybody. Let you know that I am a real person. I am going to turn my camera off for the duration of today's presentation, just so I'm not distracted. I wanted to first say hi, but just so as we move throughout today's discussion, as Megan mentioned, we bring a unique perspective to this conversation. I am an insurance broker with an employee benefits focus. So we spend most of our time, or I spend most of my time, helping businesses evaluate, implement, and better manage their group health, dental, vision, life, and disability programs. The lens that we look through, right, in consulting and how we approach these conversations is very much one of helping our clients become employers of choice, right? And this is very much a conversation about recruiting and retention. And so everything we're going to talk about today, I hope that the thing you take away from this discussion is that while today's topic is going to be very specific about how to prepare for an upcoming renewal and what you can do to take control over the process, that the reason why we're talking about this and why that matters is because if you take control over the process and you are prepared, right, going into your next renewal for your benefits program, that should lead to better outcomes. And better outcomes means, right, a better member experience and therefore, right, a better story from a recruiting and retention perspective. And so at the end of the day, that is why we do what we do. Okay, so with that, I am going to turn off my camera. Hopefully everyone can hear me okay, can see the screen okay, and we'll go ahead and continue. Okay, so it goes without saying, I think, for many practice managers and owners, there's a lot of anxiety around the health insurance renewal process. This is the time of year, right, when you're thinking rates are going to go up, things get more expensive, plans are going to change. Oh, I've got to talk to my broker again, right? It's been a year since I talked to that person. Right? This is the time of year where oftentimes, right, people are left feeling like it's becoming more expensive to maintain the benefits they had, or they're having to reduce benefits and still paying more. And as mentioned, there's just a lot of anxiety that comes with that. Our goal today is going to be to help take some of that anxiety out of the process. Okay. And so what we hope you'll take away from today's discussion is more insight into how to develop a proactive renewal process rather than being reactive, how to hold your broker accountable, assuming you're working with a broker and you know who they are, and really just to take control over the situation and improve outcomes. So first and foremost, when we talk about what a renewal is, for many, as I mentioned, it's the time of year that you may dread the most. It's when your health insurance plan likely increases in cost each year. It is your opportunity to make plan changes or carrier changes, and it is typically when you shop around for health insurance or benefit program alternatives. What many people don't know is what goes into determining your renewal. So today, to start, we're gonna break this down a little bit and try to give you a peek behind the curtain because I think it's important to understand when your broker comes to you and says rates are increasing by 10%. How's that number arrived at? Right? Like, how do we get to that 10% number? Your renewal is comprised of 5 components. What we call trend, what we call manual rates or plan factors, group specific demographics, a medical diagnosis load. There are some caveats to this one here we'll talk about, and then business pooling or market segment pooling. Here I'm referencing small business pooling in particular, with the assumption that most listening today and most animal hospitals, broadly speaking, fall into the small business market segment, defined as having fewer than 50 employees. So let's break down each one of these things further and try to highlight the impact they're having on your renewal as we know it. So trends from an insurance company's perspective relates to the cost of doing business. Okay, this part of your renewal is influenced by the inflation of medical costs. And if you were to challenge an insurance company, many of them would tell you they don't have any control over quote unquote trend cost increases each year. When we talk about medical inflation, right? Of course, we're talking about things like prescriptions becoming more expensive over time, the cost of care becoming more expensive over time, right? All of that matters. But to help illustrate the impact this has from a renewal or a health insurance perspective, I like to use a really basic example. Let's just say, for conversation's sake, that you offer a health insurance plan with a $50 copay for a specialist office visit. Okay, so a dermatologist, for example. If in the current year, someone goes and sees that dermatologist and the cost of that visit is $200, your employee, right, your participant pays their $50 copay. The insurance company pays the other $150. If next year that same office visit now costs $225, but your plan doesn't change, so employees are still paying the same $50 copay, the insurance company is now paying $175 for that same encounter. Multiply that, right, that impact, right, that $25 difference in this example, right, times the millions of members, right, and how many millions of office visits, right, are processed each year, right, for any one insurance company. And you can see the real impact that that has. And so part of what we mean when we say trend, or when an insurance company says trend, right, and sort of it describes that as the cost of doing business, what they're getting at is right, in some way, shape, or form, the example that I just highlighted, which is it becomes more expensive for us, right, to pay claims. In many ways, that cost is not being passed on to participants from a benefit perspective. And so therefore, we need to increase premiums, right, to account for that. And for most, trend is going to hover somewhere between, call it 7 and 9%. So like out the gate, before any other factors are considered, we are looking at, for many people, right, a 7 to 9% increase, and then adjustments are made, dialing things up or down from there based on some of these other factors. Okay. Manual rates or plan factors pertains to the cost of any particular plan offered by an insurance company. So the plans that insurance companies offer are the products that they sell, just like any other business. And from time to time, they reprice some of those products to make certain products more or less attractive based on engagement, utilization, right? Adoption, Are one plan set of plans performing better than another? And so you might find, right, that the carriers somewhat arbitrarily will just make HSA plans cheaper in 1 year and some of their PPO plans more expensive, or introduce different networks to make one plan cheaper than another plan, all things being equal. And that's happening, right? And it's not always obvious where it's happening, but that's happening behind the scenes too. So call manuals or factors, right? Some component of your overall renewal attributed to just sort of product, pricing at the carrier level. Demographics is a big one. And this has to do with the average age of a group, number of males versus females, the industry of the business, and the number of employee-only coverages, those covering a spouse, those with a child or children on a plan, or a full family. What's really important to know, though, is for small businesses, small groups under 50 employees, the male-female ratio is not taken into consideration, and age is weighted more heavily than anything else. This is why many of you listening might have an age-rated health insurance plan, where every person on your plan has a different rate dependent upon their age. And your older employees are paying more than your younger employees. This is a direct reflection of what we're talking about here. Medical experience is what we would call the risk adjustment, if you will, in the pricing model. What they're looking at from a medical experience load standpoint is claims paid, and so actual utilization of the plan or consumption, right, of healthcare services paid for by the plan's premiums. And not only what was paid in the current plan year, but any claims projected to be paid into the next plan year. If, for example, someone on your plan has a recent diagnosis and is prescribed an expensive medication, that we expect that person to be utilizing into the next year, the insurance company is going to want to increase the premiums to account for that new claim, right? Those claims that they know that they're going to incur and have to absorb into the next plan year. And so that's what medical experience is describing. Now, for small employers, those that have fewer than 50 employees, unless you have a self-insured or level-funded health insurance plan, claims experience is not taken into consideration. So if you have a small group plan, for example, and you're fully insured, traditional plan from a carrier, and you're getting a higher than average renewal, and your broker said, well, it's based on claims or utilization or health risk factors. None of that is true. Okay, that only matters in a self-funded or level-funded plan, or for employers that have more than 50 employees in most markets, and some it's 100. But again, this comes back to the age rating of most small group plans and why you're seeing older employees paying more than younger employees, because the carriers can't price based on risk, utilization, or other factors. They have no choice, right, but to price based on age and have to assume as we get older, we consume more healthcare. And then business pooling. So this is when an insurance company is going to look at or evaluate the profitability of an entire market segment. So for example, they might look at their book of business and say, okay, our 2 to 50 market segment, our small business pool is underperforming. We need to raise the rates across the board for every employer to achieve our target profitability margin or whatever the case might be. And they're going to assign a credibility factor, right, to your group. And as you become larger, your data becomes more credible. And this is very much a large group consideration. But here's an example of what I mean by that. So let's just say you were a larger practice with 75 employees. And based on your claims experience, demographics, plan designs, enrollment, et cetera, the insurance company says, right, we need to assess a 7% increase to your account specifically to get back to our sort of target in our underwriting model. But now let's assume that you're in the mid-market segment, right? Employers with 50 to 99 employees with that insurance company, and that market segment for them underperformed, and so they need to assess a 10% increase across the pool, right, that you're a part of. Well, if your data is considered 50% credible, then your actual renewal by the time you see it, which is really a blended renewal, is going to be, in this example, 50% of your renewal, right? So 50% of the 7% renewal you should have gotten based on your own experience, 50% of the 10% renewal ascribed to the book of business that you're in, right? For an actual renewal that's getting released at 8.5%. time, but all you'll ever see is the 8.5% renewal. So hopefully this was helpful just to understand what goes into the model and how that is calculated. The key to taking control of your renewal process is starting early. I cannot tell you how many times we get phone calls. It's happening now, right? As recent as this morning, where a practice manager reaches out and says, hey, we need help. We haven't heard from our broker, or we just got a renewal increase and it's really significant. Can you help us? And I say, of course I can. When do you renew? And they say October 1st. Well, today's September 12th, right? There's not a whole lot we can do. And that happens time and time and time again. So proactivity is key. Starting the process 120 days prior to your renewal. So reverse engineer it. You know what your renewal date is. If it's January 1st, that means you've got to be having conversations, with your broker in late August, early September to at least start the planning process. If it's March 1st, work backwards from there. So call it December. You should be having those conversations. But 120 days really is the time when you want to be having conversations. Mainly because most insurance companies don't allow retroactive changes. So if you are late to the party and you want to submit a request for plan design changes in October, retro to 9/1, or after, right, 9/1 passes, but retro to 9/1 if that's your renewal date, that's going to be a challenge. You need to make sure you've got adequate time to think about your cost sharing strategies. So not only focusing just on the carrier and the plans and the price of the plans, but how are you going to share, right, the premiums with your employees? And make sure you've got enough time to evaluate and digest benchmarking data and can be more strategic in making decisions. So what should you be doing 120 to 90 days out? Well, first and foremost, choose a brokerage team to take you to market. And understand that having more brokers doesn't make the market more competitive, not from a health insurance perspective. So really identify the broker that you want to work with based on experience, how well they understand your business, how engaged they are, how supportive they are, what their ongoing support model looks like beyond just preparing for your renewal. Are they exposing you to new ideas? Do you feel like they have a good handle on the process? Do you feel like they care, right, about you and about your employees? Spend some time learning about new plan ideas or new techniques. We'll talk about level funding or consumer-driven health plans or things like that. Well, if you're starting the process 2 weeks before your renewal date, chances are you don't have a whole lot of time to get educated on a conceptual level about some of the things that other employers are doing. But if you're 120 days out, you can spend time learning about consumer-driven models or level funding or direct primary care or virtual primary care platforms that can be layered in to create a new plan design option. You can talk to the vendors, you can demo certain things. You have the luxury of time, and having that time can make all the difference. Make sure you've got an updated census on hand. Clearly define goals and objectives. What are we trying to accomplish? And survey your employees for feedback. So just like you wouldn't build a house without a blueprint or grocery shop without a list, we suggest you not approach your benefits renewal any different. So clearly define your goals and your objectives. What are we trying to accomplish? What have you budgeted for, right, as far as a potential increase, either in employer contributions or total spend? How do you think you're performing in certain areas, right? Create a scorecard and work with your broker. And it can be really simple. Our employees understand our benefits. Rank it 1 to 10. 10 being they really understand, 1 being they don't at all. How do we solve for that? We feel like we're in control, right, of our benefit program costs. We feel like we maintain an equitable financing arrangement, right, in the sharing of our costs between our employees and the practice, right? Create the scorecard and then walk through it and be honest and identify, oh man, I think we're underperforming in this area. I think we're doing okay over here. And then talk to your broker and develop a game plan and prioritize. What are the 2 or 3 things that really need to be addressed in that year? And how are you going to tackle that? And this helps you be strategic and create actionable insights that you can then work towards accomplishing. And if you're a practice manager listening and your practice owner needs to sign off on making decisions, get them involved early and make sure everyone is on the same page. From an employee feedback survey standpoint, this is really important. Now, you should be prepared, right, that if you're going to ask employees for feedback, you're going to get it. And I think you're worse off if you ask for feedback and don't act on it than if you didn't ask at all. So be prepared to take action. But who better to ask employees what they want or what they value or what's not working on your benefits program than that, right? Again, if this is all a conversation about recruiting and retention, well, if the people that we're trying to hire, right, or the people that we have, right, already working for us don't understand or don't value the benefits that we're offering, it's really hard to be effective. So get some feedback. Find out if the provider network is too small, right? Are you having a hard time seeing the doctors you want to see? Are the plans too expensive? If your deductibles were higher, but in exchange for that, your premiums were lower, would that be tolerable for you? Are there other benefits we're not offering that you really want? Are there benefits we're offering that mean nothing to you? You don't participate and you don't care. Should we deploy those dollars somewhere else? And get that feedback. And your broker can help you, right? Most brokers have question banks, right? Written content that you can take and you can distribute to capture some of this feedback. But again, you've got to start early, because if you aren't capturing this feedback until 2 weeks before the renewal date, it's really hard to digest it and act on it. But if you're getting this feedback 6 months right before the renewal date, you've got plenty of time to sort of ingest it all, right? Make sense of it and figure out how you want to respond to it. And collaborate with your broker on this. Right? Hey, this is the feedback we got. What can we do about this? And start there. From a benefit design, right, or cost control standpoint, right, what are some of the things that you should be considering? So this comes back to, if we're starting early and we have time to get educated about new ideas or things different from what we're doing today, then what are those things that we should be asking our broker about? Well, chances are you probably have a fully insured health plan today. So what about self-insurance or level funded models built for smaller practices? Ask for some education, right? Ask for some exposure. Or things like advanced healthcare strategies, steerage-based plans. So for example, United Healthcare's Surest model, all copay-based plans, no deductible, no coinsurance, that have a provider scoring methodology, right, baked into their network, whereby providers that have achieved higher scores have a lower copay attached. And members are incentivized in the form of that richer benefit to see the higher quality, lower cost, or higher performing doctors. It's what we would call an advanced healthcare strategy, or a steerage-based plan. Get some exposure to that. Try to understand, how would that impact our employees? What does that look like? Are we even a candidate for that? Provider network is a lever that you can pull that many don't know exists, or that many don't know carriers offer different networks. So a lot of the carriers have their really broad, right, PPO network. That's expensive. And then oftentimes have more limited, right, or narrow or performance-based networks. And many times you can offer them side by side. And many times the more limited network is going to be less expensive. But you've got to do your homework. You've got to work with your broker to figure out, are there these other network options available? And which doctors are in the network? And would this even be a good fit for our team? For example, I'm in Chicago, in the North Shore in the suburbs. And there are like 5 major hospital systems here. But if you live in the North Shore where I am, chances are you really care about what used to be North Shore University is now Endeavor Health. And so, for example, Cigna, just as an example, as an insurance company, offers their large, broad national PPO, right? Go anywhere, see anybody. And then they have what they call their Local Plus PPO network. Where I am, that Local Plus network includes North Shore, Endeavor Health. Well, if you only ever see doctors at North Shore or Endeavor, why would you pay more money to have access, right, to other providers that you're never going to use? And as an employer, you can offer both of those plans side by side and let the employee decide which plan they want to enroll in. And that Local Plus option is about 7% cheaper, all things being equal, than their broader open access PPO. And so asking questions around, right, network and access to care can be really impactful in terms of strategy and pricing, beyond just the benefits themselves. But it takes time to do the analysis to understand network disruption, right, and all of that. Consumer-driven health plans. I'm sure everybody's familiar with the term HSA or health savings account, but learn about HSA eligible health plan options. And does it make sense for us to possibly fund or seed money to employee HSAs as a cost saving strategy? Or healthcare reimbursement accounts, or HRAs. This is a strategy that's really effective, that's available to small employers to essentially buy down coverage, paying less in premium, and then offsetting that exposure in the form of a healthcare reimbursement allowance for employees that may be higher utilizers to make them whole while everyone saves money, and those that don't use the plan often, which is most people statistically, are no worse off. So ask, are we a good candidate for an HRA? Is there a plan we could find that we could pair with an HRA that would generate some savings for us? Can you model out the impact? Can we make some assumptions about HRA utilization? What's our maximum exposure, worst case scenario, and what's more realistic? Is it 20%? Is it 30%? And this is something that you have the luxury to do if you give yourself enough time. So call it, 90 to 70-ish days out. This is when you want to make sure your census is finalized. You want to make sure you have a go-to-market strategy clearly laid out. What lines of coverage are we exploring? What carriers are we going to? Make sure all of your plan documents, right, are accessible. That you've got a copy of plan summaries, billing statements, et cetera, especially if you're engaging, right, a new broker that's going to work on your behalf but doesn't have all of the historical information like your, prior broker would have, and just get everything together. Reason being that at the 90 to 75 day mark, we can actually go to market and we can start to talk to other carriers and we can start to get quotes and actually model out some of the financials for different options about 90 days out from any one effective date. So if you've got a January 1st renewal, it's in October typically that we can get quotes and actually start putting pricing to all of these things that for the last month we've been talking about were more just conceptual in nature. We were just strategizing. But now that we've had those strategy discussions and we've essentially created the shopping list, it makes it much easier to go to the grocery store. Right? I know what it is I'm looking for and what I'm trying to solve. I know what you're excited about. I know what's resonated. I know what we've decided is not going to be a good fit, right? Just based on the concept alone. And so we've pivoted, and that makes this much easier. But when we go to market, carriers are going to want to see your plan summaries, your current rates. Obviously, we need the census. They want to know enrollment by plan. So we can verify that off of a billing statement, for example. So we have to have a clean data set to give to the other carriers. And now, right, we're 70 to, call it 30-ish days out. You're going to get your renewal from your current insurance company. For most, hopefully closer to 90 days, but realistically for many, you're going to be at that like 70, 75 day mark. If you're smaller, right, that's going to be more true. If you're larger, you'll get it a little bit earlier. It very much depends on the carrier at times and the funding methodology. But now, theoretically, we've already done our homework though, right? If the process is working the way it's laid out, we've been proactive. So we've already gone to market. We know where the rest of the market is at for options that are similar to what we have today, or for options that are different, but based on, right, the strategies that we've already learned about and we're interested in exploring. And now it's really easy to line that up side by side with the renewal and identify, is there an option, right, that's really compelling? And why that's important is because let's just say, for example, that you went to market before you even got your renewal, and we found quotes for a comparable plan with an alternative insurance company that was 5% less than you're paying today. You might look at that and say, doesn't really matter what the renewal is. We're just going to move carriers, right? We're going to take the 5% savings. We know our renewal rates are going up. They're not coming down, right? Historically. So why even wait, right? Like, let's just get the ball rolling on moving carriers and starting open enrollment and being really, right, early to get this done for our employees. And that's certainly a path we could take. Or we might find, hey, the market's not that competitive. The next best option is 10% above where you are today. We have to now wait until we get your renewal. But now once I get your renewal, it's very easy for us to say, well, the renewal is 8%. The next best option in the market was 10, so we should renew as is, or consider some, minimal plan design changes to bring that down to a 5 or 6. But we can essentially like discard, right, the other carrier options and not waste any more time if we are only getting your renewal, call it, right, 70 days before the renewal date. But what happens more often than not is nothing is done until the renewal is received. The renewal lands, it's a 12% increase. We're now 65 days out from your renewal date, and the broker is now reacting and saying, oh, we have to go source other options. And now you find, right, it takes 10 days, right, to get the quotes, to analyze the quotes. Now you're 50 days out from the renewal, 45 days out, whatever it is. And now you're recognizing we have no other options. It didn't get better. We wasted all this time. Now we're scrambling to get open enrollment prepared for and to get things done when all of that work could have been done ahead of time. So making sure that you're out to market and that things are being evaluated even before you get your renewal is key. Once you've now analyzed the marketing results, you've seen the renewal, it's really easy to make decisions about plan design, carrier, submit whatever paperwork needs to get submitted to make whatever changes are being made, and then develop an open enrollment strategy. So from an open enrollment standpoint, this is what you got to think about. And it should be intentional. How are we going to educate our employees? Think about incorporating different media types, webinars, recorded presentations, infographics, newsletters, a customized benefits guide. We're using podcast tools now to create these like micro learnings, right? Or audio files that are more discussion oriented, right? Where there's some back and forth dialogue between podcast hosts, making it easy to digest information about your benefits program, or right, even things like health plan terminology, what's your deductible, what are copays, et cetera. But really think about who your audience is and what their preferences are. How do they want to receive information? And work backwards from there. In-person meetings might not be the best method for your hospital. And then determine who's going to lead that process. Are you doing it or is your broker doing it? Probably should be your broker. But you might have to collaborate with them to say, hey, we've got a team that skews relatively young, right? Millennial, Gen Z, preference for on-demand resources, not the attention span to sit through a 45-minute long presentation. Many of them, right, may want to share information with their significant other or even their parents to get some feedback about what they should do, right? They're leaning on those, right, in their, right, sort of circle of trust for guidance, for advice, how to give them resources that they can easily digest, that helps them understand and see the value in our benefits, that they can access when it's convenient for them. That could be 11 o'clock at night. It could be while they're at the gym, walking on a treadmill. It could be while they're out walking their dog, whatever the case might be, right? How do we give them this information in a way that's easy for them to digest? And how do we support them if they have questions, right, or they need more information in any one particular area? Is there a budget for custom communications, right? Some of these things maybe you have to pay for. Maybe it's worth the investment. But again, if you're not starting early and you're not having these discussions, then chances are you're just going to get whatever your broker gives you. And for most people, it's not going to be enough. There's more there. So from an education standpoint, it's really important to make sure you're covering what's available for your employees, what coverage is best for your employees, right? Help them understand how they may utilize the plan and what's best for them based on that expected utilization or cost, et cetera. What resources or tools are available to help them be more effective users of their benefits, who can help them if they need assistance. But this is complicated stuff. And for a lot of team members, right, especially those that are younger, this might be the first time that they're making these decisions. Or how many people are turning 26 and aging off of their parents' plans? They've never enrolled in benefits themselves before. Just handing them an SBC from your carrier and a rate table might not be super helpful for them. And so what are some of the ways that we can reach that audience and meet them where they are, so to speak? And this all matters because, well, I'll get there in a second. I don't want to lose the headline. But just an example of helping someone understand what coverage is best. Employees have different user profiles. And not everyone's going to use the plans the same way, which is why it's important, first and foremost, to offer more than one plan option to your team. But then it's right about helping them understand, okay, well, if I identify as this sort of non-user, right, and I'm just paying my premiums right each year and maybe getting a preventive visit, what plan might yield the lowest net cost for me? If I'm your average user, I get my preventive visit, I see a doctor a couple of times because I'm sick, or I visit a dermatologist a few times, I fill a couple of medications, I'm still paying my premiums, like what plan is best for me? And if I'm that maximum utilizer, right, what plan is best for me? And you can see here just a really basic example, right, for your sort of non-user and your average user, it's the plan with the highest deductible that yields the lowest net cost. When you factor in premiums, which is often overlooked, right, which is a big part of the equation, It's right. It's not always the case that the plan with the lowest deductible and lowest out-of-pocket exposure is the best fit. But then you see for that maximum utilizer, the person that's expecting to hit their out-of-pocket maximum, still paying premiums, that flips for that higher utilizer. Now all of a sudden the richest and most expensive plan does make the most sense. And so this can change, right, over time, but helping them understand that, you got to look at it, all in, right? Exposure, premium, how do you expect to use the plan? And help employees back into these decisions is really, really, really important. So why this all matters? Because the more effective the communication and the more employees perceive your benefits as being great, the more they will value your benefits. And we know this is true. We've seen this. A practice that offers really, 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 really rich benefits, but does a poor job communicating those benefits to employees, is going to have those benefits be perceived as worse than someone that offers even average benefits, but does a much better job around communication and employee engagement. So now we're at that 30-day mark, okay? And at this point, we've made decisions, we've decided on what carrier, what plans, we've prepped for open enrollment, we've got all of our education materials drafted, we've got all of our paperwork signed off on. So now open enrollment is beginning. What you really want to make sure you do is close open enrollment with enough time to process enrollments or changes, for ID cards to land, for people to be able to use the plan. I hear it all the time from practices. Well, if our benefits effective date is January 1st, and we're going to do open enrollment in December, and we're going to let open enrollment run from December 1st to December 31st. No, don't do that. If someone enrolls in benefits on December 31st, how are you getting them enrolled and processed and active in the carrier system and getting them an ID card on January 1st? You're not. And you're not required to give somebody 30 days to make their benefit decisions. Do open enrollment from December 1st to December 10th, 12th, and then leave yourself 2 or 3 weeks to get all the information, right, aggregated, organized, and then sent to your broker, to the carriers for processing, so that there's a chance, right, everybody's enrolled and active in the carrier system on day one and has an ID card, so they show up to the pharmacy on January 2nd. They can fill a medication, no problem. But that only works, right, if you give yourself enough time to process those things. And the reality is this: if you give employees, 10 days or 2 weeks to make their benefit decisions, it's more than enough time, especially, right, depending upon, the level of changes that are being made. If very few changes are being made, I think you can get away with having even less time. The reality is people fall typically into one of two buckets. Right? Those that are going to do it right away, day one, doesn't matter how much time they have, they're eager, this matters to them, they're going to get it done. And then those that are going to wait till the last day. And only after you've nudged them 3 or 4 times to do it. Whether you give them 10 days or a month, it doesn't matter. And so if that's the case, right, give them a shorter window, build a little bit of flexibility into your timeline. So if we advertise it's going to be, 10 days, we might know we've got 3 or 4 days on the back end that we can extend open enrollment, right, for those that are, not able to do it or got stuck traveling or had an emergency come up or were straggling for whatever reason. But if you give somebody, right, a month to do it and you're hosting open enrollment up to the, day before the coverage effective date, you're putting yourself in a bad spot. And I also hear from people all the time that if their benefits enrollment date is, let's just say January 1st, that they're going to host open enrollment in January. If anybody listening identifies as that practice, don't do that. That adds a whole layer of complexity for people electing benefits now, let's just say in January, that have to then be installed retroactive to January 1st. That's a big no-no. Try to avoid that at all costs. So how do we get prepared? Well, as mentioned, always have a complete census. Your broker is not maintaining your census for you. Now, if you're using Employee Navigator or Ease or some sort of online benefits enrollment system, then that's all being updated in real time, assuming that you're using the system, and that data can be downloaded out of there at any time, which is one of the advantages of having the technology. But if you are doing enrollments with PDF forms or paper applications and you're just sending them in for processing, you want to make sure that you're keeping an updated census on hand. You want employee and dependents names, dates of birth, gender, the health plan they've chosen, what level of coverage, their children need to be listed. If someone's on COBRA or state continuation, include them and identify them as such, employee home zip codes. And if you're quoting things like disability or life insurance, we need occupations or job titles and salaries or hourly wage. All of that is critically important to have. You want to list all full-time employees on the census and mark the ones that aren't covered as a waiver. And if you can, indicate the waiver reason, right? Don't just send in a census that only has those electing coverage. It matters how many are eligible and who they are. Full-time is typically defined as those working 30 or more hours per week. And for most carriers, the participation requirement is 50% of your eligible employees, which is why knowing how many total eligibles you have, not just who's enrolled, is really important for your broker to know. Other things to think about. Are you going to quote, for example, a level funded plan? And are you going to be required to go through medical underwriting? What's the process going to be for that? Are you going to have to do individual health questionnaires? Can that be done online? What's the time frame that that's going to take? So you can bake that into your timeline or your calendar. All these things need to be discussed ahead of time. Medical underwriting is the process by which carriers evaluate health risk factors in your population for small businesses for level funded plans. And for many, this may require employees to complete health questionnaires, and that takes time, right? And so you've got to add that into your timeline. Underwriters are going to take that information and then assess what we would call a premium load or a rate increase based on, right, pre-existing conditions or known health risk factors present in your population. There's no pre-existing condition limitations in health insurance. No one's going to be singled out and denied coverage, or no one individual is going to be charged more. But these models that are priced based on risk will be priced based on the perceived risk and what that means in terms of potential claim payments present in your population. But for a good risk group, these can be really cost-effective models. But the only way to evaluate that risk is to go through the underwriting process. This impacts employers with 50 or more employees. In some markets, it's 100, or anyone that's self-insured or level funded. Again, it's the process by which insurance companies assess and price for risk. And typically, you have options on how to approach this. Employees can submit a health questionnaire. Oftentimes, that can be done electronically in a secure portal. There's sometimes what's called gatekeeper underwriting, where you as the employer can fill out one health question on behalf of the entire group, saying to the best of your knowledge, right, you're not aware of X, Y, or Z, right, condition being present in your workforce. Or sometimes carriers are using a predictive analytics tool, oftentimes, right, in today's environment, now powered by AI, to make some underwriting assumptions based on demographic data and other similar employers. Which is it's the easiest approach, right? And that you don't have to ask employees to participate or do anything, but may not always be the most effective approach. Having employees fill out health questionnaires, right, in the absence of any real tangible claims data, is often going to be the most accurate approach and lead to the best result, although the most cumbersome. Okay? So to get prepared, if you're going to consider one of these alternative models we've talked about, is identifying if this is even applicable. Decide if you're going to pursue it, and what's the process going to be. Online, paper applications, right? What's the timeline? Most carriers won't accept health questionnaires completed more than 90 days before the effective date. So if you're targeting a January 1st go live day, you can't start the underwriting process until October. No matter what, you've got to have your ducks in a row. And after you've gone to market, after all the results have been presented, right, digesting the information is key. You want to, of course, consider options within your current insurance company, because there may be a more cost-effective option than what you've considered. And if you're with your current insurance company, you're not going to be required to go through medical underwriting because they already have claims data on your population. Even if that data is not released or made available to you, they have it. So sometimes that can be the path of least resistance. So consider plan design changes. Consider network changes. If you're with United Healthcare, for example, and you're fully insured, they offer level funded plans. Ask if you're a candidate for their level funded model. There are things that you can do even with your current carrier that can be really effective. You don't have to move carriers to save money or get creative. All that said, you do want to compare options with other carriers And you want to start that analysis with an apples to apples comparison. It is not helpful, in my opinion, if you have a $1,000 deductible plan, for example, with United Healthcare, for your broker to show you a spreadsheet that only shows you a $5,000 deductible option with Blue Cross. Because while that option may be cheaper, it's not apples to apples. In order to know if another carrier is competitive, we first have to compare like plan to like plan, and then we can make plan adjustments from there. But it's important to at least know if we were to try to keep our coverage as close to what we have today as is possible and pursue another carrier, what does the rest of the market look like? And then evaluate consumer-driven models, right? And see if there's anything attractive there that you can lean into. Right? So oftentimes when we're talking about a consumer-driven health plan, we're referring to higher deductible health plans, usually offered in conjunction with a health savings account or HSA or a healthcare reimbursement arrangement or HRA. Again, the idea here is to shift more of the cost of healthcare expenses to employees with the hope that they'll become better healthcare consumers, right? That's the thesis that's being tested by these plans. But when it comes to HSAs versus healthcare reimbursement arrangements, right, either way, the idea is to use premium savings to offset exposure. Contributions you would make to an HSA create a fixed expense for you as the employer. Right? Those dollars become the employee's dollars once they're contributed, whether they're used or not. Whereas with an HRA, you know what your worst case scenario is the amount of money that you've pledged to employees, right, in the form of a reimbursement, but you retain any unused dollars. So why might you offer a plan like this? Well, these plans are typically offered at a discount from a traditional PPO. Can be offered as a lower cost, call it, catastrophic option for employees who may be less concerned about, right, total out-of-pocket costs. They're relatively young or healthy, and they know they need to have health insurance, but they're looking for ways to save money on premium and not thinking about that doomsday scenario. It gives some of your higher earners, right? So at times your doctors or managers another savings vehicle, and HSA can be a great way to reduce their tax liability. But there are some best practices to keep in mind. I would offer an HSA or a consumer-driven health plan option as part of your health plan program, but not necessarily, completely replace more traditional options unless you're making a significant contribution towards out-of-pocket medical expenses. You must commit to education. Employees need to understand the differences and how this works. And if you're going to go the HRA route, you've got to hire a third-party administrator to manage the reimbursement and allocation of those funds. Don't do this yourself. To make it a little bit less abstract, right? Just the idea behind an HRA, for example, is let's just say you had a $1,000 deductible PPO plan, and at the next renewal, you raise the deductible from $1,000 to $5,000. Well, we would expect that $5,000 deductible plan to be significantly cheaper than the $1,000 plan was. But now, of course, right, we've increased exposure to employees by $4,000. So in the perfect world, you would then pledge to employees a $4,000 healthcare reimbursement allowance that's activated after they've met the first $1,000 of their deductible, right? They had a $1,000 deductible before. So now you say to them, okay, you've got $1,000 of exposure again. And once you've met that $1,000 from $1,001 and beyond, you're eligible for reimbursement, right? Company funds available to you for the next $4,000, at which point, once you've exhausted all those funds, you've then technically also hit your total plan's $5,000 deductible. But what we know is that most people don't spend, right, even $1,000 a year out of pocket on healthcare. So if they don't hit that threshold, they never activate the HRA funds. So no exposure to you, and they're no worse off because if they weren't meeting $1,000 before, then they're not meeting the $1,000 now, except the plan they have is cheaper. And so you're leveraging your healthy folks against your unhealthy folks, and the premium savings that you've generated by buying down, the coverage is what's offsetting the HRA reimbursements. Practices that are a good candidate for an HRA, it's not really size, determinant. It's more what your benefits program currently looks like. If you're offering a really rich plan and you're contributing, right, a majority of the premium, right, percentage wise, and you've got a lot of enrollment in that plan, those are the things that we look for to identify if you're a good candidate for an HRA. If you're, for example, only offering a plan with a $5,000 deductible today, and you're contributing up, flat $150 or $200 a month, or only paying 30% of the premium today, there's probably not enough room there, right? Like buying down the coverage further doesn't generate enough savings to offset the HRA. And if you were contributing a flat dollar amount before to the premium, then any of the savings that are going to be generated from buying down the plan are accruing to your employees, not to you, unless you change the flat dollar contribution. And so it gets harder. The least generous, the less generous your plan is now, the harder it becomes to make the economics work inside of an HRA. But where we still see a lot of practices offering very generous benefit programs, there's a real opportunity there to leverage this strategy to save money and not compromise the quality of the benefits offered to your team. And as you prepare for your renewal, this is also a great time to perform a compliance audit, right? Is your waiting period compliant? It can't exceed 90 days. So even if it's first of the month following 90 days, chances are that's also out of compliance. So it's either got to be 90 days coverage starting effective day 91 or first of the month following 60 days. But many don't even know what it is, right? So confirm what's on file with the carrier and if it aligns with what's in your handbook or what you want it to be, and make those changes. Are you offering coverage to all eligible employees, right? Those working 30 or more hours per week. Have you provided the required benefit summaries to your employees? Do you have the required compliance documents for pre-tax benefits? How are you administering COBRA if applicable? Are you providing or distributing the required annual notices every year during open enrollment? And so this is a really good time to, once you've made all your decisions and everything is buttoned up, to also spend a little time focusing on compliance. Right? What do we need to be doing, and is this the time of year that we should be addressing these things, distributing the notices, etc. So as we get close to wrapping things up here today, before making any renewal decision, from my perspective, there are 4 things to consider. And if you take away nothing else from today's conversation, remember this. Ask yourself, what is the purpose of having a benefits program? Are we offering benefits because we think we have to, or does some law say we need to? So we're just trying to check the box, right? Give us the cheapest, the cheapest thing you can find. Or is it to attract and retain quality employees? For most, it's the latter. What types of coverage do you want to offer? Health insurance, dental, life or disability coverage, and why? And then second, do you want to offer these benefits as employer paid or as voluntary benefits, meaning the employees pay all the premium? Right? We have some practices that say we want to offer health insurance and that's it. Great. We have some that say we also really want to offer a short-term disability plan and we want to pay the premium if it's feasible, because we know how meaningful this benefit is for employees that go out on disability after, for example, having a baby, which is a common occurrence, right, in vet med. And we know that if they have to pay for this themselves, they won't do it. But we know how important, right, the salary continuance is when they're not working. And so we're going to pay for them to have a short-term disability plan. Great. We come back to goal setting, defining objectives. This is part of that conversation. What do we want to offer? And how do you want that to be structured? Who's paying for it? Have employees been included in the process? Right? Do they have a voice in the decision-making process? Do you have any method for collecting their opinions, right? Thoughts, feedback? Are we surveying them? And lastly, are you thinking about your benefits program 1 year at a time? Or are you thinking about it 3 to 5 years into the future? And there isn't a wrong answer, but the time horizon is going to inform, right, your objectives, which is then going to inform the strategy. If you're thinking about selling your practice in the next year, it's probably best to try to make minimal changes during your next renewal, because as soon as you sell your practice, your employees are going to have to go through another open enrollment, and more changes are coming when they get absorbed into, right, the corporate entity that you sell to, for example. And if you know that that's coming, it doesn't make a lot of sense to do something really disruptive right now. Try to preserve status quo. But if you're thinking about, right, where you want to be 2, 3, 5 years down the road, maybe you just bought a practice or you just built a practice, you're growing, you're thinking about opening a second location. Whatever it is, Knowing where you want to be a couple of years from now also might inform your target objectives and therefore the strategy. And so those are really important discussions to have with your broker. And of course, you've got to have the right partner. You never want to go through this process alone. Don't work with a broker that doesn't help you feel good about it. You're not stuck, right? The misconception in the market is that your broker controls the plans that are available, the carriers you have access to, and the price of those plans. Meaning if you've got, for example, a plan with Blue Cross today, that plan and the price of that plan is a direct reflection of the relationship you have with your broker. Not true. Every broker, any broker has access to the same carriers, same plans, same price. You can change brokers anytime for any reason without any impact to your underlying plans or the price of those plans. So separate those decisions. There's a decision about plan, price, right? All of that, carrier, that's one decision. And there's a decision about broker partner. And those are separate and distinct things. Now, of course, the strength of your broker and the relationship you have with your broker might lead, right, to a more meaningful discussion, exposure to new ideas, more optionality, more engagement, etc. But at the end of the day, the Blue Cross plan, the United plan, whatever it is, has nothing to do, right, with who your broker is. And so if you're working with a broker, you have a broker today that you have no real relationship with, they aren't totally engaged. You've got a new person you're talking to every 6 months in their office. Or worse, you're working with a payroll company, an ADP or a Paychex or whatever, and it's totally transactional. You are not stuck. I will pause here with the few minutes that we have left and ask if anybody does have any questions. Happy to answer anything. So please just let me know if anybody has any questions, comments, anything you want me to address. Happy to be a resource in any way.
I haven't seen anything come through the chat, and I want to be mindful of people's time. So, uh, Cory's always been great to me when I've asked questions. I don't know how you get back to me so quickly, but I certainly appreciate every time. Oh, there you go. How do you find a good insurance broker?
Yeah, that's a really, really, really good question. And there's a couple things, and this isn't in no way right. Was the intent right behind this webinar to be a commercial right for me or for my team? But I do think we're pretty good at what we do. That said, what you want to look for, okay, are a couple things. One, and first and foremost, right, I think that's probably the most important thing to ask of any broker you're talking to. What is your level of experience in working with other businesses like us? And it doesn't have to be veterinary practices, but if they're working with a lot of dental clinics or dermatology offices, right, just similar demographic profiles, because that matters, right? If we're trying to design a benefits program that helps us, attract and retain team members, we have to know what the team members, right, look like, who they are, and what their preferences are, and work backwards from there. And if you're working with a broker that supports a car dealership here and a school over there and law firm over there and a manufacturer, and you get referred in and you're the first, right, animal hospital or right, healthcare clinic that they're supporting, they might not be, right, equipped, right, to help you navigate the options, right? What they're advising a manufacturing, right, facility do for their employees is going to look very different, than what might be a good fit for you. So ask about their experience. Ask them about the carriers that they're working with and their process, their approach, how they educate, what the last good cost saving idea is, right, that they've introduced to their team, right? Get a feel for what working with them is going to be like. But oftentimes too, right, personality, right? And are you going to mesh well with that person? Can you see yourself working with them, right? They are an extension of your team, right? This becomes your partner. And you've got to be able to work with that person and enjoy the time you're spending with them. And you're trusting them, right, to help you manage your second or third largest expense, right, on your P&L probably after rent and payroll. Know who you're trusting with that, right? It's a big responsibility. So, lots of associations, right, have relationships. So if you're a member of, whatever, VGP or the VHMA or, whoever, right, start there. Lots of course, right, firms like Granite Peak have relationships, right, with people that they trust, that they vetted. They can be a good resource. Asking people in your VMG group, right, or other networking groups, other veterinarians, right, they could be a good resource. My team, of course, right, is happy to talk to anybody, and even if we're not the right fit, point you in the right direction. But yeah, if you're working with someone that you just don't think is the right fit for you anymore for whatever reason, just know that you have options. You're never stuck. Hopefully that answers the question.
Thank you. And I don't want to cut you off, but I do want to be mindful of time. So thank you. I mean, the timing was perfect on this. I did the renewal process for many years, and you described a much better experience than I ever provided. So, lesson learned there. Definitely eye-opening. Reminder, if you need CE credit for today, please email us at events@granitepeakcpa.com. We'll send you a certificate. Next month, October 10th, we're talking about content marketing, which I'm sure we could all use help with as well. You can always follow us on our Facebook page, the Veterinary Ledger Podcast, and we will see you guys next time. Thank you so much, Cory.
Yep. Thanks,
Appreciate
Megan
you.
and team. Thanks, everyone.
Bye.